Jordon Iorio is here from Brant Mental Health Solutions, and I wanted to talk to you today, Jordon, because new restrictions are in place in Ontario, but I want people to know that that does not mean they can't go for counselling. So let's talk about that.
I think when it comes to going to counseling for mental health, there are many different kinds of practitioners. And I actually wrote an article months back about that because I thought it was important. Because you hear people say, I don't want to go to a psychiatrist or a psychologist. It's always like the first thing that comes to your mind. But in actuality, that's on the more rare end of who you would go to for counseling. Now, if you require a strict diagnosis, then you would go to that, but or a medication. But we have people that identify like myself as a counselor. We have people that are registered psychotherapists. We have people that are social workers. There's even some mental health nurses that practice counseling. So, I mean, there's a vast array. So first, it's looking up, if you're looking for counseling, it's those terms. And two, if you're part of a regulatory college, that kind of gives you instructions of what to do as a practitioner. They're all, from what I've seen and talking to colleagues, kind of sending out the same message that, we're essential. Certain practitioners are kind of using their discretion as to if they really only want to do online counseling. Most places are offering that, like my office is. But the way I'm interpreting it is that we provide healthcare, and this is just my personal view on it. I found a lot of people are practicing what I am, is that since we're viewed as essential, and if I view mental health as health overall, that if a nurse can go, I can go, or a doctor can sacrifice, I can sacrifice. So I have that conversation with my clients, but I try to really gauge how they're feeling in terms of online versus in person. And I've found that if somebody really is kind of leaning towards coming in person, it's probably a good reason that they really want to be there in person. And trying to force somebody to be online for counseling, I haven't found that to be a very good tactic. So,
And certainly, some people don't have a safe space to do that online. So, and there's that barrier there, but also as a counselor, as somebody who reads people's body language, what is the difference between, having somebody in front of you and being able to recognize that maybe there's more to it than what they're saying, as opposed to a conversation like this?
Sure. I think a lot of it is one, being in the Brant area. Yes, Brantford is a growing city. We're seeing Paris, where my office is located, starting to grow. It is still much different than being in the GTA, Toronto. I mean, it's just the fact that a lot of jobs in those areas are more high tech. They involve more video chatting, and I think it's getting used to it. That's one. And then two is it's kind of unconsciously associated with I do it for work and I chat with my friends. I don't do that for health, right? So we see it with, especially during the pandemic, with basic medical doctors that, you have an eye infection, you don't want to go in. So there are online services to see a doctor, right? So they're really trying to push that for basic services. But when it comes to counseling, it's comfort level. And then I guess the third thing is trust. That's the first thing you try to build in counseling, is trust, because there's nothing without that. And there doesn't need to be any academic kind of scientific terms when it comes to energy, right? You feel somebody's energy, that's part of trust. Can you do that over video? I believe some can and some can't. So.
And one of the other things I wanted to talk to you about is we've had so many different rules over this last year. Let's say a year. It hasn't been quite a year, but I'm going to say year. And there's people that interpret it differently. And then there's people that are like, I don't get it anymore. Everything's open, but this is closed. And what does that do to your psychology in terms of actually following the rules?
Okay. So There are many things. Luckily, they've started to talk about this, like psychologists and researchers, and I've been trying to keep up with it. I had an inkling as to why people are having a hard time or sticking with their personal beliefs. That's a big one. So there's a psychological, I guess they say like a phenomenon called like belief perseverance. So that is just being dead set in the position on, in this case, the virus and maybe the government's protocols, and not moving from that. Because belief perseverance, it's just maintaining the belief we personally know as true. So like, to me, since last April, not me personally, I'm in somebody else's shoes, I think the virus isn't dangerous at all. Right? So no matter what you tell me, if you tell me even a study on from Harvard University comes on TV and says, no, it absolutely is dangerous for certain people, and that's why we need to take it serious, that doesn't match with my personal deep-seated belief, because that's threatening to my brain and my basically your identity. And we don't like that uncomfortability. We have to maintain what we believe, and that's how we kind of get, so some people get through their day. Is it right or wrong? That's for people to decide. I believe you should follow what protocols are, but that is some people. And we also have like our basic desire for control and feeling secure. So humans need to be in control of our lives. That's the first thing we go to manage anxiety and stress. So it's basically like satisfying to our mind to feel like we're right or that we're the expert, right? So yes, I'm not meaning to offend anybody, but conspiracy theorists, people that are posting things that are very opposing beliefs, it is it's just the comfort of being the expert is satisfying, right? So we see a lot of that. So with new a lockdown being in place, I think we're going to see that increase. Is some of it justified with feeling confused? Absolutely. We've seen the government have to come out and clarify, I think, 2 more times since they announced the lockdown, what is essential, what you can do, and what you can't do. So yeah, is it fair for some people to feel confused? Yes. But I think if we kind of try to use a bit more common sense, that might help. But yeah, there's definitely some psychological stuff going on. And yeah, it's kind of like a comfortability, sense of control kind of thing going on.
And sometimes accepting a conspiracy theory feels better to us than accepting the reality of the situation, right?
That's right, exactly. So it's like our brain demands the truth, right? And if the truth doesn't match our values, then that is competing. So they say competing thoughts, right? So it's like vaccine is dangerous versus fact that vaccine is as safe as flu shot, right?
Now, I know that, and we've talked, and we talk regularly about mental health, and we've talked about it long before COVID, and we'll talk about it long after COVID, because certainly it's been a mandate for us here that we feel it's important to have these conversations in Brantford, Brampton area. In your opinion, what do you see happening in terms of our mental health from this? Do you have any concerns going forward, what this will mean for some of us with this continued lockdown and rules?
For sure. I always try to stay. I have no ego when it comes to trying to be an expert in all fields of mental health. So I really try to keep up on, do I deal with some traumatic things in my work? Yes, but am I specifically a trauma counselor? I'm not. But so I talk to my friends that are, right? And all the feedback I got is they are definitely expecting similar things to people that experienced what they would call in that field big T traumas. So those are the very, we will say, intense traumas, abrupt. This will be a long-term trauma that kind of adds up to something similar to that. So, I mean, I'm not allowed to diagnose, but, psychologists, I believe, will probably see a lot of PTSD coming up. And you're going to see, I can imagine, a lot of people that aren't struggling, not understanding why people have the symptoms of that disorder. If again, I can't diagnose, but psychologists, I imagine, will see that, and we will also see absolutely mood disorders. Sure, right? I can't diagnose that, but we can help. People like me can help treat the symptoms because that's the focus, anyways, right? So, very very low mood, anxiety, malaise. People will say unmotivated, people secluding still, just because I know me personally, when I get the vaccine and say they open up some travel, if I feel safe, absolutely, I feel like it would be good to go on a vacation, right?
Mhm.
But I think you're going to see some people maintain this seclusion, and it be confusing to those who are feeling okay.
Well, we know that there's going to be need for services going forward. And one thing that in my discussions with yourself and others involved in mental health is that they are seeing an increased demand for their services. What do we do if we feel that we're needing help, or that we know someone is needing help, and it's an uncomfortable conversation to say, I've noticed you haven't been yourself, maybe you need to talk to someone. How do you do that in a safe
Uh,
way without offending
yeah,
or hurting someone's
yeah.
feelings?
I'm happy you asked that because I've had multiple parents usually ask me that in the last few weeks, and I've always found the best way to go about that is I understand not everybody is but some people just say an emotional person or likes to disclose their personal uh, issues, business. But it's very, very powerful if you can what we call self-disclose. So I'm not telling anybody that they have to say, "Oh, had this very serious assault when I was 13 years old," and every single little thing that happened. But to open yourself up, that's what gains trust and makes somebody feel like it's okay to then share how they're feeling or what they're going through. So if you can open up, I just say just open the door a little bit for them, then it kind of signals to them that then it's okay. But if you, especially younger people, they feel like you're bugging them or poking them. If it's, what's wrong? Can you tell me what's wrong? So that tactic it tends to work a lot better than the other.
I like that idea because I think showing vulnerability allows people to feel safe in their own
Exactly.
vulnerability. And I appreciate, again, you joining me today and chatting. It's always good to have these conversations. And I know I'll be messaging you in a few more weeks to say, hey, Jordon.
Anytime.
So thanks again. And if anyone would like to get in touch with you to book services, what do they do?
Easiest thing would be to call 519-302-2300, or you can do reception at brantmentalhealth.com. And we're very good with getting back to people as quick as possible. So